Okay, good evening, everyone on our channel, the BHS Health Education channel. My name is Robert Metonono, and I'm the founder and director for Brigham Healthcare Services. Brigham Healthcare Services is a company registered in Ghana, Accra, and our office located at Lakia Koshi in Accra. Today, we are going to have some few discussions concerning why health education is important in Ghana. And so all those who are watching us on our channel, we do several series of discussions and things concerning health. And we upload it on our channel, and then we want people to know about health. So this is a brief discussion that is between several of our company's nurses living across Ghana. And we want you to listen to us as health professionals and nurses who are joining us to learn from some of these the things. So we are going to come up with a few points, and I'm going to do that. But before we proceed, I want you to mention your name and then where you are located. Please kindly unmute yourself. Don't mute yourself during this discussion. The participants who are joining us, Christy, Honesty, and Abigail, don't mute yourself. Don't mute yourself. Unmute yourself, everyone, and turn on your camera so that our audiences and people who are going to watch will learn from this. And so the BHS company has nurses and doctors all across Ghana who assist in health education, consulting online, home care for the aged, and other health services. And so I am the one who directs the affairs of this wonderful program. And so to start with, my name is Robert Metonono, and as I explained, I'm the leader for Brigham Healthcare Services. I live here in Latvia, Koshi, where the company office is located. Please mention your name and then where you are from. So we start with Christiana. I said, please don't mute yourself. Everyone. Christiana, go ahead.
I am Christiana, currently talking from Malam.
Your name well. We didn't hear you well.
I am Christiana Vanderpoel, currently talking from Malam.
Okay. Christiana, you are what's your health profession?
Healthcare assistant.
Okay. Healthcare. Okay, now Honesty. Your name,
yeah,
and what? Go ahead.
okay. My name is Hannes Tijvenu. I'm talking from Kaswa, and sometimes you find me at home as well. And I am a nurse assistant preventive.
All right, thank you very much. Now let's go Abigail. Abigail, your name and where you are talking from, and your location and your health profession. Please go ahead.
Please, my name is Abigail Amoa. I am talking from Kenya Hospital, Kumasi.
Kumasi. So we have said,
yes.
We have repeated and repeated, no one should mute themselves. And you have to turn on your camera.
Yeah, I'm currently at work. Let me put you on the camera so that you can see. I'm at work. And yes, then so, it's not clear.
So the first thing is that why is it important for health education to be pioneered in Ghana? As Brigham Healthcare Services is pioneering health education. What do you think is the reason? And I want you to understand that educating people on health is very, very important. And there are several reasons, okay, that we are going to discuss with. Today we are going to discuss on several reasons. One is, once health education is pioneered, there is disease prevention that's going to work. follow-up. Okay, so disease prevention is one of the main things, because once people are able to understand, some of the consequences of some of the diseases and some of the things that lead to people getting ill or sick, is going to prevent them from having those diseases. So that is the first thing. And so I will go to take turns. What are your thoughts concerning that? Start with Kirsty, and then we go to Christiana and Abigail.
Oh, Allah.
Do you agree? Do you agree that prevention, once health education is pioneered, that is going to lead to disease prevention? What are your thoughts on that? Honestly, we are waiting for you. What are your thoughts on that?
Yeah, please pardon me with the question again, please.
Yes. What we are saying is that one of the main reasons why health education is important is prevention. Health education leads to disease prevention. What are your thoughts on that? Is that true or that false? So when you are done, we go to Christiana and we go to Abigail. Go ahead.
Oh, okay.
Go ahead.
Yeah. Thank you, Director, for the question. Yeah, it is true. It is very true. Health education leads to disease prevention. That's where we educate individuals on how to protect and prevent these diseases, most especially these communicable and non-communicable diseases from happening. So when the education comes in, it's then knowledge is built on how to prevent these communicable diseases, which reduces more new infections. So with more educations, lesser new cases of these non-communicable diseases. So with this, I believe health education leads to preventing of diseases.
Okay, wonderful. Now let's also hear from Abigail. Abigail, what do you think? Abigail, what do you think about what you have just shared? Abigail. Christiana, what do you think about what we just shared? Health education leads to prevention of diseases. What are your thoughts on that?
Thank you. It's true. It's true about what you just said as the topic says, and it doesn't just prevent. It also reduces the risk of cases or of conditions that we have. Because sometimes someone has the knowledge about it and knows I have to do this to prevent, I have to do this and that, but then we are not always able to, or unawarely, we get attacked with a case or with a condition.
Christiana,
So with the education, that
can't hear you well.
hello, please, is it better now? Hello.
Be audible.
Hello.
Go ahead.
Please, can you hear me now?
Yes.
Hello. Hello, please, can you hear me now?
Can hear you. Go ahead.
Okay. As I was saying that as the topic is saying, health education helps to prevent diseases or cases that we have. But to me, it's not just about preventing it, but sometimes the prevention is we know about the disease and we know what and know what to do in order not to get attacked. So with the educators out there, even if we are being attacked or being faced with the condition or diseases, the health education also helps to manage and control it as well, aside the fact that it's preventing you from getting it.
Very much. Now let's hear from Grace. Grace, what are your thoughts on this as well?
Please, you said?
Grace, we want to hear from you also, your thoughts. Grace, we want to hear from you. So kindly, we want to hear from you. All right, so let's talk about the next thing. So I think that health education also, one other reason that is also very important is that Grace.
Sir.
Please, we want to hear your thoughts on what we're talking about. The first thing, health education. I mean, we are saying that it helps us prevent diseases. One, health education is pioneered. What do you think about that?
Yeah, it's help prevent disease because it creates awareness for people to be aware of certain disease conditions, the causes, the preventions, and the management, so that they'll be aware on what to do to stay healthy and all that.
Okay. So please, next time when you are responding, turn on your camera so that we can see our audiences who are going to watch. They will see who is speaking. Okay.
All right. So, thank you.
All right. So the next thing that I want you to also understand, the second point why health education is important is that it helps improve public health. Okay, it helps public health, and so once health education is pioneered across Ghana, okay, that is, it's going to help promote good, healthy lifestyle. People are going to learn how to live good, healthy lifestyle. Okay, once people are able to learn to live certain good lifestyles, they will be able to, live better lives. What are your thoughts on that? Let's hear from Christiana first. What are your thoughts? Health education, once we pioneer it very well, is going to help improve public health. What do you think about that? Please turn on your camera. We'll end very soon, okay?
That's very true, as you say. Sorry, my camera is messing up. How do I even put it? It's very true in a sense that it makes one has more knowledge about a particular condition and how to live. Because with me, I'm setting as an example, I could be someone who loves oily or fatty foods. But with the fact that, and we always live on things depending on our tongue and our taste, if I should say that. So with health educations going out there, I get to know the risk about some things I take in. So with that, it helps me to know how to live healthy and to have a healthy living. That's what I can say.
All right. So let's hear from Honesty.
Okay, thank you. Yes, health education is actually of paramount importance in Ghana, because Ghana still has health challenges persisting here. So empowering individuals and educating them, educating communities with knowledge and skills. I'm sure health education will serve as a key tool in disease prevention when it comes to maternal and child health, and also in addressing the growing burden of non-communicable diseases in Ghana. Thank you.
Okay. So let's move to the next one. The next reason why health education is also very important is that it helps and empowers communities. Okay, that is community knowledge. People, citizens in a community, they will have a better knowledge about health conditions and many other things. And it helps build communities, okay, and makes communities much better. What are your thoughts on that? We'll start from Grace, and then we'll go to Christiana. Go ahead, Grace.
Yes, sir.
Please, go ahead.
Yeah, so it helps communities, but in a sense that most people in the rural areas have no knowledge about health education. So when they are being educated about their health, they intend to improve their health by doing what is necessary, what is the best, they intend by doing the needful thing by improving their health. Example, like advocating on hypertension, because people are in the rural areas where they have BP, but they are not aware. So they get to know what are the do's and the don'ts about hypertension and how to do to improve and how to do and to manage them. So that's what I would say.
All right. Thank you very much. Christiana, what are your thoughts on that? How does health education help build and foster communities in Ghana? Please turn on your camera. Thank you.
Thank you. Just as Grace said some few minutes ago, we have a lot of communities that are even aware. They are aware of their conditions. Like she used hypertension as an example. They are aware of it, but then they don't really know what to do and not what to do. Just like someone who might be hypertensive and is aged, they always want to have a full of everything. So they end up doing things like, if I should use eating habits, instead of reducing salt, they know when there is salt in a meal, it's very nice. So they keep up eating the salt in a proportion that is going to harm them rather than reducing. So with the health education going out there, it helps for the aged or the older ones to also know one or two things on how to manage